In NHS 24, clinical supervisors clinically responsible for the calls that they take. So they will manage a pod of call handlers who take calls, and when they need support with their calls, depending on where they've got to within the call, they will ask for my clinical input. So they'll summarise where they've got to with the call, what questions they've asked, what responses the patient has given, and then I've got to consider what's the next step in terms of further questioning, what's the most appropriate safe outcome for the patient. To be a clinical supervisor in NHS 24, you need to be able to talk to all sorts of patients about all sorts of symptoms. For me, when I'm asking a patient questions, I need to be able to see them. So if it's a mum phoning regarding a child with a fever, I have to be able to see what that patient looks like. I have to imagine that patient sitting next to the mum. You know, is the child on a tablet? Is the child lying floppy? Is the child chatting away to mum and playing with toys? So for me, I've got to ask enough questions that I can get a mental picture of what's going on in that house. Because the mum might be extremely worried because she's not had she's not had a child with a fever before, or the mum might be very laid back and she doesn't realise the child's really unwell. So I've got to get an understanding of the symptoms, and for me a lot of it is about getting a mental picture. The best part of the job is the variety, because you're dealing with patients from all over Scotland with all different types of symptoms, and even if someone is a bit upset, I can understand why they're upset. So I'll say to someone, I know you're upset because your mum's not well, but if you just bear with me and just tell me a bit more about what's happening with her breathing just now, we'll get you the appropriate help. Or if it is a dad with a child with a sodium who's screaming, I'll say to the dad, right, you'll need to tell me what you've given her for pain and whether it's helped or not, because I am going to get you some help, but I need to know a bit more information before I do that. So I like the fact that you're dealing with lots of different symptoms and lots of different types of people, and that the patients have faith that I'm doing my best for them, and that they might feel that they need an ambulance or a home visit, but I say, well, no, this is what this is appropriate for, and this is the best thing to do for your relative or for yourself just now. So it's about, I suppose, winning hearts and minds and making patients feel that they're getting a very professional quality service, and that they understand their part in it in giving me information. I would say that you'd be surprised how many transferable skills you've got, because I didn't think I had a strong clinical background when I came here, because a lot of my peers had worked in acute care for a lot longer than me and had done a lot more technical nursing roles than I had. But it's not about it's more about how you triage someone, your listening skills and evaluating, and your decision making and using your judgment. And you do that every day in nursing. You just don't realise how much you do it and how you can hone it into this type of environment.